you going? It's Donna here, and as promised, I told you I would give you a couple of extra lower back mobility exercises that involve some twisting to hopefully help prevent injuries in the future, because like I've said in the past, it's quite often when we are adding a twist to some sort of movement that we end up straining our lower back. So if we can get the body used to twisting, hopefully that will prevent those type of injuries happening. So I thought I'd show you, excuse my cat, he's just crashed out and doesn't want to move. Anyway, so I thought I'd show you on the bed, because they're really that simple, and you can do them, on your bed, or, first thing in the morning when you wake up, and just to get that sort of lower back nice and mobile and moving again. So, lying down, resting your head back. Now you really ideally don't want to use a pillow for this, so that your neck's nice and neutral. The pillow will have your head up, okay, and that will place a bit of strain on that spine, the top of the spine, the cervical spine. So rest the head down without a pillow. Take your arms out wide to the side and have your palms facing upwards. Now during this exercise, you want to make sure you keep both of your shoulders flat on the bed, or if you want to do it on the floor, you can do it on the floor. Okay, feet up nice and close to your bottom. Draw the belly in, and now all we do, looking straight up so that neck stays neutral, is just rolling the knees nice and gently from side to side. Now you may find if you've got quite a stiff back, you're not going to be able to move very far, and that's fine. You just take it at your own level, okay? Myself, I'm a little bit more mobile, so I can take those knees all the way down to the side. Now if you want to advance the level a little bit, you can actually bring your feet up off the floor, knees at 90 degrees or a little bit less if you need to. With this, make sure you draw your belly in a little bit more, and make sure your back doesn't overarch. So you need to sort of push it a little bit into your bed. Some people actually like to place their hands under their lower back, so then you can just sort of apply a little bit of pressure to your hands by tilting that pelvis down and squashing your hands a little, okay? So from there, tummy in nice and tight, and once again, just gently, knees from side to side. And as I mentioned earlier, only take it as far as you need it. You don't want your lower back to lift off the floor or off the bed. You do want to maintain a slight arch there, because the spine does naturally have that curvature in the lower back, but you don't want to make it sort of overarch. So you really need to draw that belly in. Once again, while you're doing this, make sure both your shoulders stay firm on the mattress or on the bed, okay? And you're actually going to feel that working into your waistline while you do that. You can advance that level once again. You can straighten up the legs, okay? And just gently, keeping both shoulders on the floor. Take it side to side, only as far as you need to. And that's pretty much it. The second exercise can be done on the bed once again. Just sitting up. Okay. Feet, ideally you want your feet firmly on the floor, because having your feet up off the ground, letting them hang, does place a little bit of stress on the lower back. So feet firm on the floor. I don't have anything down there at the moment, so I'm on my tiptoes just to make sure I've got that support. Got short legs. Draw the belly in nice and tight, lift up tall. Just bring your hands up about level with the chest, and you just gently, bit of rotation, side to side. As you do this exercise, you want to make sure you're creating space between each of your vertebrae, which means you're lifting up nice and tall. Imagine there's a string attached to the very top of your head, pulling you up. You've got your chin tucked in slightly, okay? And of course, through all the exercises, breathe. Never hold your breath. So you might breathe in, and then exhale. Breathe in, and exhale. And just nice and gently. It's all just about getting mobility through that lower back. So there's a couple of exercises with a few different advancements if you wish to take it to whatever level. Be careful, of course. Always take things to your own level, and make sure you're listening to your body. And by all means, if you need to and you want to, you can see your physician first and make sure that everything's safe for you to do. But I highly encourage it. Great to get that lower back mobile, and like I said, prevent some injury in the future. Ciao for now.